and here's the big deal. Because of the results, and I presented these results at a UCLA Medical School seminar that we had in 1973, fall of 73. The results on animals were so amazing that it helped legislators understand that this was not hypnosis or voodoo. And so, okay, so if it works on a horse and it works on a human, okay. And that helped get the law passed in a lot of places because we had the data. In fact, I mean, how would you hypnotize a horse and say, you don't have emphysema anymore? There's no placebo factor. That's just it. Yeah, there's no placebo involved.
Good day, everyone. I want to wish you a happy spring and welcome to a webinar presented by the American Acupuncture Council. Today, we're very fortunate to have someone who has been involved in acupuncture since actually it was before licensing in almost any state. He was a co-founder of NISA in Boston, as well as many other things. One of the things that he did that we're going to talk about today is animal acupuncture. He actually brought it to this country. He's going to share with us a history from China. And what I want to make you please understand is if you want to do animal acupuncture or acupuncture on animals, whether they be small or large, you need to be sure of what the regulations are in your own individual state. You want to check with the board. You want to know what you have to do in order to be legal and to be covered on malpractice insurance. So good morning, Dr. Bruno, and welcome. We're happy you're with us. And so can you tell us a little bit, probably just a brief history of where acupuncture started in China and how it got to the United States?
Good morning, Marilyn. Thank you for having me on today. Let's bring up the first PowerPoint. So, Marilyn, the earliest records that we have of animal acupuncture were in China, about 930 BC. The focus primarily was on horses because of their military importance to ancient China. Interestingly, the earliest recorded animal medicine doctor was named Chao Fu. We don't know much more about him than that. Next slide. Later on, during the first, second centuries BC, there were some texts that referred to herbal treatments of animals. There were some charts that referred to bleeding and cauterization. There are some significant references to animal acupuncture on horses as late as the 11th century, but it didn't actually reference acupuncture. The references that are important for animal acupuncture were mostly between the 6th and 10th century, but those texts have been lost. Next slide. So from the 11th century until the 14th century, there really wasn't any expansion of animal acupuncture. The few texts that were published past, say, the 12th century referred to plants and minerals, bleeding, cauterization, but no acupuncture. Next slide. We come to the 17th century in Europe, and we find the very first book that is written on animal anatomy by Italian Carlo Ruini, written on the horse. And next slide. And then we find that although the origins of animal acupuncture were in China going back 3,000 years, Western medicine never included that, even after certain missionaries had actually returned from China during the 16th and 17th century. Next slide. And it wasn't actually until 1971 where members of the veterinary research group for the National Acupuncture Association began a veterinary research project that animal acupuncture was actually reintroduced into the United States and effectively into the world. Acupuncture was introduced about 1972 in general. There was licensing going on. There was licensing that was being prepared in several states. Oregon in 73, Nevada in 73. There were several states where it was legal if you were under a medical doctor. In California, it was legal if it was in a research setting, as we had at UCLA Medical School. And there were several other places where research could be done using acupuncture. But the first laws came into effect in 73. Next slide. Okay, so we need to go back to the next question.
Let me say this. As I understand it today in the United States, the only state law that actually has animal acupuncture in it is in the state of Maryland.
That's correct. In Maryland, if a owner of an animal has taken that animal to a veterinarian within a certain recent period of time, they can then take that dog, cat, horse to an acupuncturist without any referrals, without any supervision, and then the acupuncturist can treat that animal. There are a number of other states, very few, but a few, like Oregon, for example, and Illinois, where if you have a referral from a veterinarian, you can go ahead and treat that animal without any type of supervision. There are quite a few states where an acupuncturist could treat an animal under the supervision, it may be direct or indirect, of a veterinarian. In many cases, this is going to take place in the veterinarian's office.
So, but acupuncturists, depending upon the state where they are, should check on that to be sure, so that they know they're treating legally.
They have to check in their own state. And the situation often is where I know acupuncturists who actually treat animals in neighboring states, and those laws can be a little different. And so they must make sure that they understand the regulations for their specific state, especially since they're licensed in that state, and they must not just follow the law, they're trying to also protect their acupuncture license.
Okay, so tell us how animal acupuncture really kind of began to take hold in America, and then kind of what's happened to it, and that is actually, I would say, being revived at this point.
So when John, now you go back to 1971, 72, there were a group of 5 of us in the National Acupuncture Association that were strictly acupuncturists. We also had medical doctors associated with our group at UCLA. We also had a whole team of staff. Most of the other acupuncturists really that we knew were classical Chinese acupuncturists, including our teachers and other acupuncturists who understanding there's no licensing at the time, but still some other acupuncturists who in fact were practicing in different areas in the San Francisco area, in New York, other areas. But in terms of training, John and I were doing research. We were contacted by veterinarians who wanted to learn how to do acupuncture on animals. And one quite persistent veterinarian, Dr. Glassberg, convinced us that he would help us with a comparative anatomy on small animals and make contact for a person that we could work with on horses if we would teach him animal acupuncture. And so that's how the animal acupuncture program really got off the ground. That's how we met Alice DeGroot, an equine surgeon, one of the people that provided us with the comparative anatomy on horses and many, many horses to treat. And it was that veterinary group because of the results that John and I were getting on the horses that went directly to the veterinary board in California and allowed us to treat animals without a veterinary license, to treat them with acupuncture without a veterinary license.
How did that change? Because today in California, they can only treat as a unlicensed vet tech. How did that change?
Interesting. John and I not only were able to treat animals, we were also certified by the California Horse Racing Commission so that we could treat at the racetrack. And John and I were on those books for many, many, many years, and eventually we were taken off. But I had long left for Oregon. I was not in California. John continued to work with veterinarians and was treating animals all the time, but he was treating animals at a certain point as a vet tech once he was taken off the books as an acupuncturist who could treat. Going back to 1974, 73, and 74, we had established a national acupuncture veterinary association for vets, specifically the ones we were training. Okay. We didn't have other acupuncturists to train. We knew that veterinarians would be more interested in this than anyone. And we had already been working with them under their supervision in a certain way. And so we trained them. After we formed that association, others came over and we helped them form IVAS, which is the International Veterinary Acupuncture Society, which is the primary training program for veterinarians who want to do veterinary acupuncture.
In your experience, why don't you tell us a little bit about some of your experiences with horses, since I know that you do treat horses, Dr. Bruno.
Okay. Marilyn, it's interesting that you asked that. One of the first horse conditions we treated was emphysema, and this was in Southern California. This was a veterinarian, Alice DeGroot, that Dr. Glassberg had taken us to as a contact for treating horses. And the reason that she wanted us to treat this horse with emphysema was basically because in the very last stages of emphysema is because she wanted to get rid of us because she knew we couldn't treat it. What she didn't know was that this condition is something that we actually could treat with acupuncture in humans. And so by transposing certain bladder points to the horse, we were able to actually treat this horse successfully. Within 3 treatments, the horse's breathing was normal. At that point, Alice DeGroot was willing to do almost anything we asked her to do in terms of treatment. We explained to her that we wanted to try to treat the conditions that were difficult to treat in Western veterinary medicine. The next one you see, laminitis, commonly called founder, is inflammation of the tissue in the horse's hoof that simply causes total lameness and eventually loss of the hoof in severe cases. It's completely untreatable with Western veterinary medicine. And we were able to get over 90% success rate complete cures with acupuncture. Also, there's a lot of tendon injuries, nerve injuries, lameness injuries that sometimes are just caused by trauma from the horse. And acupuncture is excellent with that. Colic is one of the big killers of horses and really difficult to treat. And acupuncture was much more successful in dealing with colic than the techniques they had in Western veterinary medicine. Facial paralysis responded really excellently. Tying up syndrome is a condition in horses that usually involves muscle spasms and pain in the low back that will completely take a horse out of commission, whether it's a riding horse, a racehorse, whatever. And very untreatable with Western medicine, responded excellently with acupuncture. There are also a lot of internal conditions we treated. The example there is allergic reactions to chemicals in the environment. And so that's just like a handful of some of the conditions we've treated.
Well, it sounds to me like they've been successful. And is there any research going on today in veterinarian schools or independent research that has been funded on acupuncture in animals, probably using vets in most cases?
Almost none. I mean, really the research that was done initially by John and I was unique in a certain way that it almost stands alone. One of the things that we were really lucky was that we were able to treat horses at the racetrack who were injured. Why is that? Because the records on these horses, their running times, etc., were so detailed that we had records that existed that were detailed before and after treatments to give us indications of how horses responded. Plus, just besides our clinical observations, we actually had some hard written data. But as far as I know today, there's very little research being done, except in the sense of clinical work. There was one of the early cases that we treated after we treated that case of emphysema was a horse with severe laminitis. The horse basically couldn't walk. It was extremely lame. And John and I treated the horse 3 or 4 times, and the horse actually recovered so that it could walk around. It never became a racehorse again, but it was a horse that was able to be completely treated properly and successfully.
Okay, but you had one just recently that the lady said she could either come to you as a patient or her horse could come to you as a patient. And you treated the horse.
Yeah, I remember the case you're talking about. And actually a neighbor. What happened was that this horse got kicked in the hind hip, okay, on the left hind leg over the hip. And there was a severe tear and trauma to that area that wouldn't heal. It wouldn't heal. And so the horse was just lame. And she was a neighbor, so I treated the horse. After the first treatment, I checked on her a week later, and she said the wound had actually closed and healed. The swelling had gone down. All the water retention that was in the leg had been cleared up. And I treated the horse one more time, and the horse has been sound ever since.
I consider that a miracle story, Dr. Bruno.
Okay.
Dr. Bruno, I know that in Los Angeles, northern Los Angeles County, we have a veterinary hospital run by a female vet, and she treats only cats and dogs, and she treats only for cancer, whether it be the side effects or the actual cancer itself. She is a vet. The reason I know this is the person who works for her is going to acupuncture school. So tell us a little bit about dogs and cats, because probably not everybody's going to treat a horse.
That's true. Okay, can we bring up the next slide? So here are a couple of the common things we used to treat in small animals, dogs. In dogs, hip dysplasia. Intervertebral disc syndrome is really common in many dogs. Acupuncture does very well with treating skin disorders, allergies. Musculoskeletal problems are extremely common. And you mentioned cancer. Very early on, I had a veterinarian who wanted to know if I could treat viral leukemia in a cat who was going to die, probably in the next few weeks. And so I did successfully. And there was a second case with viral leukemia in a different cat that we treated, and that was also successful. So the application of acupuncture to small animals is probably more common in terms of treatment than an acupuncturist treating horses, and it's just as valuable, extremely valuable. So, for example, with hip dysplasia, this is a very, very difficult thing for Western veterinarians to treat with their techniques. With acupuncture, it's not difficult at all. And with some of the cases of cancer, they're either impossible to treat or it's very hard to give the animal some relief. unless you do use acupuncture.
Have you written any kind of a book or brochure or anything on particular protocols, or is it custom for each animal as you see them and diagnose them?
Well, actually, I'm finishing a book on horses, acupuncture points for the horse. If you want to look at what I'm doing with that, we could bring up the next PowerPoint. I'll show you some old horse charts, and then I'll show you the ones I've done. So here, Marilyn, is an example of a horse chart. Okay, it's from about the 13th century. The thing is that a lot of these points are for bleeding or for moxa, and it's not very illustrative in terms of what the points are. When I worked with my first teacher on translating this chart, there isn't as much information as it looks like there actually is on there. Let's go to the next chart. We'll show you a modern. Okay, this is a chart that John Ottaviano and I did. It was our second generation chart. And this was not a chart that we published, even though somebody published it later. This was for our own personal use. Let's go to the next chart. These are what the charts kind of look like today. Let's go to the next chart. Here's another chart. The books on these points like this usually use the human description of the location, which is actually not accurate on a horse anatomically. Next chart. Here's a chart that is completely useless. I mean, I don't know how you're supposed to find a point on a horse using this chart. They're all transposed points, many of them not accurate at all.
What about the
next chart?
What about the plastic models that I see that are shown on that acupuncturists can buy? Are those particularly correct?
They're particularly horrible. Here's an example of a chart that I've done. Okay, showing close-up location of point, a couple of points on the face. Go to the next chart. And then what I'll do is take it internally, showing muscle structure, tendon ligament structure around the same points, and go to the next chart. And then I'll take it all the way down, taking away the muscle, so that you have an absolute, clear, unequivocal location of a point. Okay, in the book, and we can leave the charts. So in the book, I describe the location of the point. Then we have several charts showing its location and the indications for that point. And sometimes special notes simply about cases that I've treated with horses for certain conditions, or stories about discussions about that point that I've had in the past with some of my first teachers. That book is probably 3 to 4 weeks from publication.
So if a person was interested in doing this, it would be a good idea for them to either contact you, figure out how to get the book, go to one of the events. But it is an up and coming, I would say, protocol. And I think more and more people would be interested in this because we have many more dogs and cats, and we have lots of rescue groups that help with that. And the other thing is people will take care of their animals sometimes before they take care of themselves.
Right. And we do have, like you say, a whole field, a whole unknown quantity of animals out there that can receive excellent help from acupuncture. Also, you know, in a certain way, it's like starting over. Back in the 70s, when before licensing in the United States, it was a long and tedious journey to get acupuncture license from various states, develop national organizations, so that people could have the benefit of acupuncture. Okay. that journey will have to be, in a certain way, be repeated when it comes to animal acupuncture. You know, as we know, there's one state where the licensing, where practice is excellent in Maryland. There's some states where it's okay with referrals. And we all know, and well, I think we all know that in the very beginning in this country, many state laws only allowed practice on humans with referrals from medical doctors. And of course, that's changed. But in a certain way, we're going to have to go through that path again with animal acupuncture in order to provide the service. The story in Maryland is actually quite interesting because when they were trying to pass their law, they were unsuccessful several times. And then there was a state hearing, and a gentleman showed up. This gentleman was one of those people who likes to go to committee hearings. The retired person likes to go to committee hearings, and he was sitting in the audience, and he asked if he could speak before the committee, because basically he could tell that the committee was pretty intent on turning down Maryland's request, their association's request, to practice animal acupuncture. And so he said to the committee members, as I understand it, a licensed acupuncturist can treat me. They can treat my wife. They can treat my daughter. And they can treat my daughter's 2-year-old baby. But they can't treat my dog. And that actually changed the mindset of the members on the committee. And I think in this country, of course, in other countries, there's so many people that have animals and, of course, love their animals. They probably love them as much as they love they're a part of their family. If these people can be convinced, if these congressmen and senators can be convinced that acupuncture is viable and an important treatment, we can change their minds the same way we change the minds of the legislative bodies for treating humans with acupuncture.
I'm going to ask you a question, and if you choose not to answer it, it'll probably be okay. Are you willing to lead this charge, this campaign? Because I think it's a very valuable issue. You're right. People do treat their animals as members of their family.
Well, as you know, Marilyn, I'm retired, right? Okay. So
That means you have lots of time.
So my goal is to have enough people who are seriously trained, competent, interested in moving this forward. Okay, because I just, I'm not going to be able to do it. No one person can do it on their own. I mean, I was very fortunate in being a part of this group that did this. I mean, it was probably the first time in my life that I realized that I was finally a part of something much bigger than myself. Okay, my goal now is to train more people, and there are some that were recently trained, to work with the American Board of Animal Acupuncture in moving this forward into different states and providing good training and continuing education programs in this field. Okay. So, I mean, I'm still in a certain way leading this along with the help of many others.
Yes, it takes a village. It does.
Yeah.
Do you have anything else you'd like to add? This has been very educational and very interesting, and I think probably will pique the interest of many acupuncturists, because I know that some of them treat their own animals at home. But think what would happen if everyone was trained, and it would certainly be a benefit, not only to the animal, but to the families that cherish them as very valuable members of their family.
Well, I think people who are interested should probably contact the Oregon College of Oriental Medicine, because they will have this seminar in late October, a one-day seminar that's going to cover a lot of the different aspects of animal acupuncture, large and small animals, and then they would be able to probably better understand if this is a field they wanted to continue with.
Thanks for your time. Appreciate it. Hope you have a great day.
Thank you, Marilyn.
And if you're interested, contact OCOM, or you can contact the American Acupuncture Council. Yes, if you are treating within the scope of your state, you would be covered for animal acupuncture. Have a great day, and thank you for joining us, and we'll see you again next month.